Hello and welcome to another episode of Discover with Spinati. I'm your host, Dr. Spinati. Today we're going to be talking about the difference between getting a root canal and a dental implant. I get this question a lot, especially on my TikTok channels, and people are asking me, should they be getting a root canal or should they just head straight to doing an implant? Because to them, they're like, well, if the root canal is going to fail at some point, what's the point of doing a root canal? Just go straight to doing an implant. Excellent questions. I'm going to be covering that today. Let me first join or get my Instagram on. Now let's keep going. So, dental implants versus root canals. Which is better? What should you do if you fall in that category? And I have a lot of these patients. They come in, either the tooth is cracked or there's cavity and there's an infection. There's some reason as to either try to save the tooth with a root canal or replace it so they can continue chewing. Now, a root canal, usually, the majority of the time, a root canal the reason is, or the modality of it, is that people that have cavities or people that have some kind of infection inside their tooth that reaches the root or reaches the inside, the pulp or the chamber where all this, good stuff is, the nerves and the blood vessels, it gets infected because the cavity reaches that area. It gets infected, and then they require a root canal. Now, what does a root canal do? I covered that 2 days ago in terms of what a root canal does. And just briefly, what a root canal does is that it cleans out, it's a procedure that cleans out all of the bacteria and all the gunk and all that yucky stuff, the pus and everything like that, out of the bone area and the tooth. And then what we do is that we plug it with something that's inert, something that's not going to react with your body. And then you get to keep the tooth for a long time. Now, the question is that how long does it last? How long does a root canal last? Now, that's a really good question. Now, if you were to walk in and get some kind of, let's say, hip replacement, right? Or get a heart surgery or something that's invasive, something that's it's a medical procedure. All these things, by the way, are medical procedures. Now, you were to ask the surgeon and you were to say to the surgeon, okay, well, I just got a bypass. How long am I expected to live, or how long is this supposed to last? The surgeon will look at you and say, well, according to studies, this has a success rate between X amount of percentage and X amount of percentage. But they will never tell you that this will last you X amount of years because they're not with you. They cannot control whether you're going to be eating things that are good for you, whether you're going to be sleeping well, their stress level, your stress tolerance, whether you're going to be smoking, whether you're going to develop any kind of morbidities, any other kind of diseases. They don't know any of that stuff. So no one can actually guarantee you anything. Same thing with getting, for instance, a hip replacement. You say to the doctor, to the surgeon, you say, how long should this last me? He'll tell you, or she will tell you, that given all the circumstances, if everything falls correctly in order and nothing changes from today, and you don't bump yourself, you don't fall, you don't gain weight, you don't, move incorrectly, you don't buy the wrong whatever, you don't sit improperly, you exercise, like given all these factors, the hip should last you X amount of years, but no one really knows. The success rate is really determined after around the first year and after 5 years. That's literally what the majority of the studies cover in terms of quote unquote the success rate of a procedure. No one actually tells you this should last you a certain amount of years. Now, statistically, you can gather a huge sample size, a huge population size, and say, okay, well, according to this, it should last you X amount of years. But every individual has their own factors, right? You can't say, well, studies show X, this lasts whatever. Because if you know how medicine works, and if you put statistics with medicine, you'll be flabbergasted as to why you're even taking medicine. But I'm not going to get into that. But besides the point, and I'm talking like literally like taking medications. Besides the point, the thing is, the whole point of why I'm delivering this, why I'm going off on this tangent, is because when someone says how long does it last, there are so many factors that play in it that we don't have any control over it. But if it fails within a year, it's safe to say that the procedure failed. It's not the factors that failed. It's the procedure that failed. Given that, for instance, you do the root canal, you get the crown, you come in for your cleanings and everything is lining up properly and it fails within the year, then something did not go right in the procedure. It's safe to say that. It's a safe assumption given that the doctor tells you that there's a good chance for this tooth to last you a long time, i.e. they give you a good, what we call in medicine, we call it a prognosis or a chance of good survival. If the doctor gives you, before they even treat you, they say, look, given my diagnosis and given my examination, this tooth has a good prognosis for it to last a long time, given, you follow certain instructions, given certain factors, and it fails within the year, then it's safe to say that the procedure didn't go well. Okay. But longer than a year, certainly longer than 5 years, it's no longer now the procedure. Now it's a lot of, biology, genetics, your habits, your diet, how often you come to see the dentist, how often you clean your teeth, and all that stuff. Okay. Where you're eating and all that stuff. Okay. So there's a lot of factors that come into play, but sticking to the topic as to which one should you choose if you had the option, root canal or implant. Now, in terms of a root canals, I put here, they last around 20 years because some people do say that they last 20 years. Some literature says they last around 20 years, but there's a very important factor that plays in here because the majority of people that get root canals, they get root canals because they have either a very large filling that failed and the cavity went inside, because obviously root canals, rather fillings, they get cavities underneath, right? So after you get a filling, there's going to be some time where another cavity is going to develop underneath that filling. Well, if that filling becomes quite extensive, quite big, any cavity now has a very small distance in order for it to cross into your nerves, right? So because of the largeness of that filling. So the majority of people that get root canals is because they have a cavity that went inside the nerve space, or what we call the pulp chamber. Okay, so that's what happened. When that happens, because they have large fillings, right? Large fillings or a large cavity, it is always, with no exception, it is always recommended that you put a crown on top. I'm going to show you what a crown looks like actually right now. Okay. Oh, not right now. Right now. Okay. This is what a crown looks like. It's something that's made out of porcelain. It fits right on top of the tooth and looks exactly like a tooth. It looks exactly like a tooth. Okay. But it protects the tooth 360. And so you can't get a cavity on the actual crown. You can get a cavity from underneath the crown. Okay. Given that you follow the instructions and the procedure goes well and everything is good, it should last you a minimum of 5 years, up to 20 years. Some people even say it should last you a lifetime if you take care of it well. Okay. Now, with the root canal actually, because you get to keep your own tooth, and this is where this slide comes in, because you get to keep your own tooth, right? You're keeping your own tooth. Your own tooth is inside your mouth. There's a lot of advantages to that. Your bone, you're not sacrificing your bone at all, right? Because your bone is hugging your tooth, so nothing is actually moving from this area. Your gums remain the same, and what we call the proprioception, over like whenever you're biting down, you get to feel there's that pressure, that tactile sensation, that you get to feel more of your food. You get to feel more of your tooth, right? So yes, absolutely. You don't get to feel the hotness or the cold. You don't get to feel thermal stimuli, but you do get to feel the pressure. The pressure you still feel, right? And there's that proprioception where like you get this, like there's that sensation. Okay, the food is here. I'm biting on it. There's that sensation. Okay, because you have, your ligaments are there. Everything is basically intact except for the nerve that was once inside the tooth. So that is the huge advantage, and you get to keep your own tooth. Okay, so now you get to keep your own tooth. You have your tooth, and you put a crown on it, and it's going to last you for X amount of years, given all the factors that I just mentioned. Now, on the flip side, and by the way, it is technically speaking, it is a little bit cheaper than the implant. Now, Implants. Implants, similar to root canals, they do require 1 to 2 appointments depending on the simplicity or the complexity of the procedure. Sometimes it can require more appointments, but on average, you're looking between 1 to 2 appointments for a dental implant. Now, with the dental implant, there are a lot of things that may happen. After you get an extraction, there may not be enough bone. Yes, you're saying to yourself, well, I mean, I did have bone with my tooth, but now you're saying without the tooth, now I'm lacking bone. Correct, because you get something called bone resorption, or you get a remodeling happening where your bone actually starts to decrease, right? So your gums start to decrease. So then when it's time for you to put an implant in, there is a chance that you may require additional bone, right? I'm about to show you a picture of what additional bone looks like. So it is graphic. So if you don't like graphic stuff, turn away. But that's what it looks like. This is a bone graft. Okay. So bone grafting is when we put additional bone in order to augment or to, make it more thick, your bone more thick, in order to increase the chance of success for the implant. So there are additional procedures, especially at the front of the mouth. There are a lot of procedures that may be required for an implant that otherwise may not be required for a root canal. So you really have to take that into account. And obviously, the more procedures that are required, the higher the cost. Okay. So it's definitely on the higher cost end. Okay. Implants also, after you put the implant in a lot of the cases, we can't load it right away. In other words, we can't put the crown on the same day. So we have to wait for the healing, okay, or the integration of the bone with the implant. We have to wait for that phase to happen, which takes around 2 to 3 months, and then we can put a crown on top. So there's that phase where, yes, now you have an implant, but you don't have the crown portion yet. Whereas for the root canal, it's not like that. Once the root canal is complete, it's literally either you can get it right away or you wait 2 weeks and then you get it after 2 weeks. And so there isn't that waiting phase, right? And also the actual tooth is still there. You get a temporary crown, so you're still chewing on it, you're still using it. Whereas for the implant, you're not. So there is a time where you're not actually chewing on anything in that space, just waiting for the implant to heal. And then you have to go back to see your dentist so that your dentist can put a crown on it. Okay, so there are advantages and disadvantages for both sides. Now, what are the advantages of an implant? The advantages of an implant is if your tooth is not savable, the implant can actually be, it is the gold standard for replacing your tooth so that you can actually chew and you can also maintain your aesthetics. So you don't have any holes in your mouth, right? Because I mean, I showed you in another podcast and another, series before this one, that when you actually lose certain teeth, you look completely different. Like you look absolutely different. And so it keeps your aesthetics and it keeps your function, and it is the gold standard. So there is an advantage to doing a root canal, to doing an implant. But the general philosophy is that if it is possible to keep your tooth, right? So if your roots are intact, if there's enough, crown portion of your tooth, if it's intact, if there isn't any fracture lines, if you don't have any periodontal, involvement that doesn't allow you to actually keep the tooth, if the tooth is not hypermobile, meaning like it's not incredibly loose and we can't save it. There are a lot of these factors that your dentist would take into account in order for them to decipher whether or not they can keep the tooth. But granted that you can keep the tooth, it is no questions whatsoever that you should keep your tooth. So if you ever had a thought as to, okay, well, should I keep my tooth or should I just put an implant in? And you had the option to keep your tooth, hands down, keep your tooth, because you can always put an implant later on. But once you lose the tooth, you've lost the tooth. So now the question is that how long do implants usually last? Implants are supposed to last a lifetime. But again, there are a lot of factors. If you're diabetic, if you're a smoker, if you're immunocompromised, if you have some factors that come into play, if you don't maintain your oral hygiene, if you don't come in regularly for cleanings, there's a lot of factors that come into play that would definitely lend to you not keeping your implant for a long period of time. So there isn't an escape. It's not like, okay, I'm putting implants inside my mouth, so I don't have to clean them. I don't have to, maintain any kind of oral hygiene. That no such thing. You still have to, as a matter of fact, it actually becomes a little bit more stringent when you get a dental implant than if you keep your tooth. Okay. One of the things that I've talked about before is the flossing factor. With flossing, when you have an implant, you cannot use the floss the same way that you use the floss when you have your tooth. When you have a floss with your tooth, you can go as far down as possible, right? You can go as far down. You can go past the gums and go as far down as possible, and then sweep up, right, to get rid of all the plaque. But for the implant, it's not the same. For the implant, when you go down to your gums, you should stop at that point because you don't want your gums to separate from that area. Okay, so it is very, it's there is a process for you to learn on how to actually maintain your dental implant versus you maintaining your teeth regularly. Even when you go and you see your hygienist for a cleaning, they use a different instrument for your dental implant than they do for your normal teeth. It's a different ball game. Okay, so there are differences and there are advantages and the disadvantages in the implant world. Now, granted that you can keep your tooth, the disadvantages of going to the implant route far outweigh the benefits of you keeping your tooth. So it's much better for you to keep your tooth than for you to do an implant if you can keep your tooth. So that's it. I hope that explained it. I hope that didn't I didn't lose you. I hope it didn't complicate things. But if you have any questions, feel free to field them to me. I'm more than willing and happy to answer any of them for you. This is what grafting looks like. Okay, this is what a dental implant is. It's three components, and this is what a fancy picture of an implant going inside the jaw of someone looks like. Okay. So this is the reasons as to why you should be getting an implant and not leaving a space there. I talked about that in another podcast, but I'm not going to talk about that here. And so if you're looking for a dentist or you're looking for a dental implant or you think you need a root canal or whatever it is, or you just require someone to have a look or someone to consult with regards to your dental health, come by to Spinati Dentistry. We're located in Hyde Park. This is our website and our phone number. And if you have any questions, feel free to field them to me. And as always, keep smiling and good night.